You said you have found out information through your organization that New York State has more mental health facilities than any other state in the nation. Is that because we have unique people living in New York State, or is it that we're more aware of the problem?
I think it was just the way it was set up years ago. I think this was, back in the 1950s, we had 95,000 people in the psychiatric centers. Now we have 4,000 people in the psychiatric centers. Some of these psychiatric centers are frankly, basically there, and they serve a very small population of people inpatient, but they serve a lot of people outpatient. So I think it's not symbolic of anything in recent years. I think it's a vestige of the past.
Well, the population of New York State is larger than it was back in the 50s, and to go from 95,000 to about 4,000 has something happened where people who were deemed mentally ill back in the 50s in reality were not mentally ill, or is it because of medical advancements?
I think it's mostly, again, going back historically, there were probably people who, back in the 50s, we didn't know about Alzheimer's. There were probably clearly people back in the 50s who had Alzheimer's, who were, should never have been in a psychiatric facility to start with. There are women, there are terrible stories that, women with people with post-traumatic stress disorder, or postpartum depression, women with postpartum depression, who ended up in the psychiatric facilities and ended up there for years. So I think that was the terrible tragedy back then. But I think what's happened is that as years have gone on, deinstitutionalization has really occurred. The medications are better. Frankly, from our end, a lot of our folks run community-based mental health services. They're much better than they were in the past. I think there was a big mistake made when deinstitutionalization really started in the mid-50s, where they didn't build the community services. So they basically let people out into the community without community services. Where were people going to go? Where were people going to go? Where was the housing? Where were the services? There were none. So frankly, we are involved, the Mental Health Association, many of our members across the state are involved in community-based mental health services. We are like, and other programs, other agencies are involved as well. We are those community-based services for those individuals who used to be, in the past, would have been in the psychiatric centers.
What is the role of the Mental Health Association of New York State? What is your role? And we have a large state. We go to Manhattan, up to Watertown, Plattsburgh, out to Buffalo.
Sure. We have 30 affiliates in 54 counties. Most of our affiliates provide community-based mental health services. So they're doing a lot of, a lot of mental health services in their community. What would those
community-based services be?
Oh, they could do everything from, you name it. I mean, they're involved in everything from treatment programs, care coordination, rehabilitation services, jail diversion programs, juvenile justice programs, youth and transition programs, children's mental health services. They're across the board in terms of, what's great about the Mental Health Association is that our members are everywhere and do a million different things in terms of community-based services. So we're all over the place. We're in, we're very involved with, again, a lot of the recovery-oriented programs that you're seeing coming forward now, recovery centers and things like that. We're involved in those sort of programs. So what we do in Albany, though, is we do a lot of, we're the repository for our affiliates, but we also work very closely with them around advocacy. What I love, what's always been, wonderful to me about the Mental Health Association movement is that our members are vested in more than, and a lot of people in the mental health community like this are more than just vested on our specific interest. We look for broader mental health issues to be involved with. So there are things that might not directly impact our members, but for the greater good of the mental health community, our members are very, strong advocates in those areas.
Now, as you know, this television show airs in Syracuse and Buffalo. You have offices in Syracuse and in Buffalo where people can go for your assistance. Could you talk about that a little?
Sure. If people want to go, I don't have the numbers off the top of my head, but if people want to find out more about the Erie County Mental Health Association or the Onondaga County Mental Health Association, we have a very strong Rochester, Monroe MHA Mental Health Association as well, Genesee Mental Health. We have all in that whole area. We have a lot of strong MHAs. If people want to find out more, they can go to our website at MHANYS.org, and we have a list of all our affiliates in those various areas.
Okay, why don't you give that website one more
Sure,
time in case.
It's MHANYS.org.
Being headquartered in the city of Albany, you deal with the New York State Legislature and the governor. Are you concerned in these tough economic times that there might be a reduction of mental health services in New York State?
Absolutely, Joe, and that's frankly our biggest concern right now. We have a governor who seems empathetic. He's only been here for a few weeks, but everything he says, he seems to be empathetic to mental health services. And but we are very concerned. We are obviously and we feel very vulnerable because of the fact is that, look, we have numbers of people who we've been working with for years in the mental health system, but we have a new cadre of people who are coming into the mental health system. People who you would never think in the years past would be part of this, but because, as we say, the economic crisis is also a mental health crisis. So people over the last 3 years during these tough economic times who have lost their jobs, who have, are in foreclosure, who have, declared bankruptcy. People like this who have, because of their financial state, it's just natural that, they're going to spiral downward in many situations. It's hard to continue to be resilient when you're unemployed for such a long time. So what happens in some cases, and not to generalize, but what happens in some cases is that people end up, with depression. With some other mental health disorder. That's a natural progression, unfortunately. So then they go in a downward spiral, and ultimately they end up as part of the mental health system. So we're seeing more and more of these people, and what happens is that our capacity is increasing, and the funding is not increasing. Now, I give credit to New York State for the last several years, to the state and to the legislature. They've been able to minimize the cuts to mental health services for the most part, but even minimizing cuts is not adding money when your capacity keeps increasing and you're not getting any new money. Well, the floodgates open and you have long waiting lists. You have people who need community-based services who are not getting them. And it's very unfortunate because, as we say, community-based services ultimately save the state money, because if you don't have those, we were talking earlier about the psych centers and deinstitutionalization. If you don't have those community-based services, a lot of people are going to end up where? In the criminal justice system, in emergency rooms, homeless, all not outcomes that anybody wants to see happen, and frankly, much more expensive outcomes for taxpayers. So I would think that the state would want to have much more community-based mental health services as a cost saver as much as anything else.
As you know, this year out in Tucson, Arizona, we had the murder of 6 individuals. We had the shooting of a congresswoman. And it appears people going back, this individual in Tucson had unique behavior, and a lot of people felt uncomfortable about the way he was acting socially with people, both in school, in college, and out of college. A school teacher had called 911 one day because of his behavior.
Sure.
A couple of classmates were uncomfortable, and when that unfortunate incident happened, there were 3 people who immediately thought of this guy. Would you say that he, to the best of your knowledge, is mentally ill?
Again, we're still finding out more every day, and more information every day. But I think that there is, it seems that probably seems to be, again, we don't know everything, but it seems to be probably that, he either had schizophrenia or schizoaffective disorder, which has been a byproduct of schizophrenia. So there are, it does seem to be leaning in that direction. But again, at this point, we don't know for sure. So
if I had a broken leg, I would be ill.
Right.
And if I saw, with my broken leg, a child walking near a cliff, and I couldn't reach the child in time to save her or him because of my illness, I would not be responsible for the death because I tried my best. But the person died because of my illness, and I was the only person around. At the same time, you have these 6 people who died. You have those who have been shot.
Right.
And this person, it appears they are mentally ill. Do you feel, and maybe the analogy is a poor one, but both situations, the person was ill, and both situations resulted in death. Do you feel someone mentally ill is responsible for their actions?
Again, it is the degree of mental. I mean, it's an awful tragedy, and I think it's the degree of the illness. I think in his specific situation, well, we still are trying to get more information on ourselves. I think what happened with him was that there were points of intervention along the way, as we say. I mean, if people had intervened at some clearly, again, not knowing enough about him, but clearly throughout the course of his life, we know what happened in his community college, that there were points where someone could have intervened to help him get mental health services. Or is he a danger to himself or others? He clearly sounded like he was a danger to himself or others. So and I don't know the Arizona laws, so I can't say, but there should have been some sort of connection with him to the mental health system, and it never happened. And so I think that's one of the failures of the system. And I think what we talk about as a best practice is things like early intervention. If somebody at an early age, starts exhibiting some of the behaviors of someone with a psychiatric disability, then you get that person the needed services as soon as possible, and chances are that person's going to have a full recovery and move forward in their lives. If that had happened in this case, who knows what had happened? It clearly, obviously, it didn't happen, and as a result, we have this terrible tragedy.
During World War II, you had the Third Reich, and you and I have talked about this, and you had men and women who went to work every day in Auschwitz and other concentration camps, and their sole function was to murder men, women, children, grandparents. And then at home, they would go home in the evening, have dinner with the family,
Sure.
and help the kids with their homework.
Right.
To me, to be capable of doing that makes you nuts. But what is you had a very interesting answer for that.
Well, I think, Joe, that there are people who are just pure evil. I mean, it's got nothing to do with a diagnosis or anything. There are people, for whatever reason, again, I don't claim to be an expert, but there are clearly people in this world who, for whatever reason, have to be so accountable for their actions because they're purely evil. It's got nothing to do with the mental illness. Mental illness is no excuse for what happened in Nazi Germany or for a lot of the catastrophes, those awful events that have happened over many lifetimes. You can't blame mental illness for that. I think that some people are just purely evil, and it's unfortunate. But to use mental illness as the reason for that really demonizes mental illness much more than it should be demonized, I think.
Quickly, do you have a particular goal for this year for the Mental Health Association of New York State?
Well, we have a lot of goals, but largely our goal is focused on the budget and to work with the budget. We have legislative days. We have a lot of advocacy that we do. We go work closely with the legislature, work closely with the administration, the New York State Office of Mental Health, to advocate for people with psychiatric disabilities. There are a lot of stakeholders who are involved here. They're family members. They're recipients of services. They're providers of services. We work with a wide range of people to really try to educate the public about mental health services and to educate legislators as well.
And quickly, for our viewers in Buffalo, Syracuse, and Albany, what is the best way to get in contact with your organization?
The best way to get in contact with us is to go to our website at mhanys.org.
Well, Glenn Liebman, I want to thank you for joining us. Glenn Liebman, head of the Mental Health Association for New York State. I'm Joe Condon, and have a wonderful day.